Hey Facebook family, welcome back to Functional Movement Friday. Today we're going to be talking about adhesive capsulitis, or more commonly what's known as frozen shoulder. So we're going to start at the chart to talk about the shoulder structure a little bit and how it can become frozen. The deepest part of the shoulder is what's called the articular capsule. The joint capsule itself, you can see these thick fibrous tissues that are here. Then here we see when this joint is in its normal resting position, there's some folds into the capsule. What can happen is that these folds can become adhesed or stuck together, and it will restrict motion when we try to abduct or lift the arm overhead. Now, we'll come right over here, and on the muscle, we can see that there's a little bit more to the shoulder joint than just that deep capsule. So we have several rotator cuff muscles here, as well as a big shoulder cap muscle, or the deltoid. And the deltoid inserts down here. A lot of people will have pain that will trigger other spots of pain or symptoms in the different parts of the shoulder joint. So we'd have to work through these more superficial structures before getting into the actual capsule itself. So today we're just going to show you a couple of real easy exercises and stretches. And so there are basically three phases of adhesive capsulitis. And the first one, the shoulder is actually freezing. When the motion is kind of limited, there's still some motion there. It's limited. Then it's frozen when there's almost no motion, and then it's thawing. When it's getting better, the actual shoulder joint is moving a lot better. So we're going to show you mainly when patients come in and they have frozen shoulder. It's very, very restricted. There's a lot of pain. So we're just going to show you some easy ones to get out of the pain. Typically, we'll get in there with some manual therapy and really unglue those structures, but some stuff you can do at home, that'll help. So this is Meg's. It is Meg's birthday today, so she took 18 years old. She was so happy. It's just great. So she's so excited to be the Functional Movement Friday model. We're going to start with Codman exercises. So this is Codman or pendulum exercises here. And the key here, we're going to see Megs is going to kind of lean over at the waist. And then by moving her body, she's actually going to get some momentum going so that you can see when she's moving, there should be no motion coming from the shoulder joint. How does it feel, Megs? Feels okay? A lot of times we'd add like a 1 or 2 pound weight in her hand to kind of gap the shoulder joint so you can come out of it a little bit. And so we'll start out, like Megs was very just kind of slow a little bit. We'll get a little bit wider with the circles. We'll go back and forth. We'll also go side to side. But the key is that the body is what's controlling the momentum of the body is moving the shoulder. We're not moving our shoulders with our muscles there, okay? So that's where we would start. Then the other exercise that we're gonna do is called a shoulder slide. So Megs will be, we could do this on the ground, but go ahead on the table here. And so what Megs is gonna do, almost like a child's pose, and then she's just gonna extend that left arm out, good, and you feel it all into here. Yep. And then come on back nice and slow. So go ahead down to your elbows like you would, Megs, and then slide that left hand out, and then come on back, just like that. All right, so you can come out of that. So with this, Megs would do several reps. So we shoot for like 8 to 12 reps. Because she doesn't really have a frozen shoulder, it was easy. You saw she got full range of motion there, but some patients, it might say, it's painful right there, and that's where we would stop. We would stop when the pain kind of sets in, okay? So I'm going to show you one more. The most common range of motion that's affected, I talked about abduction out here, also flexion, and then external rotation. So Megs, if you have a seat on the box here. So this is just a PVC pipe, and so let's just say that the left shoulder is the one that's frozen. So I'm going to have you start glued here. So Megs is starting in a neutral position. She's going to drive with her right hand. She's achieving some external rotation here. Good job. Do a couple like that. So the PVC is pushing the hand to achieve that external rotation. Awesome. Okay, I'll take that. So again, this would be to patient comfort, and this would be after maybe some modalities where we're kind of digging in and ungluing some of the shoulder, those adhesions there. So I hope this helps for adhesive capsulitis or frozen shoulder. Hope you have a great weekend. Megs, do you have any birthday plans for the weekend?
Spend time with family and friends.
Family and friends,
Yeah.
awesome, awesome. Thanks a lot, guys. Have a great weekend. Happy birthday.